Hi, George. I'm Anna, and I'll be your nurse today. Do you remember when you first got to the hospital? You weren't sure what to expect, were you? But after we talked for a little while, you started to feel more comfortable. It reminds me how I felt when I first started my BSN training. I didn't know what to expect. I soon learned that there are very fundamental principles to being a nurse. The more I learned, the more I loved it. One of the things I learned early in my BSN training is that nursing is not a trial and error profession. Our training is based on systematic theory and knowledge base. Yeah, sometimes protocols change, but I'm always working with a vast pool of knowledge that has been proven effective hundreds, if not thousands, of times. I learned what it means to work with authority. It's a way of letting patients know that as a nurse, I understand what I'm doing and you can rely on my good judgment. When patients see that I'm handling their care effectively, we build a trust that makes treatment smoother. But it's not just in a hospital or clinic that I remember my training. It's also in the community. For nurses, community sanction is a social contract that says we will practice nursing safely and effectively for everyone. Professionals around the community know that they can trust the work I do. One of the most important principles of baccalaureate nurse training is the code of ethics. To me, this is where it all begins. To be a BSN trained nurse means I will never compromise when it comes to patient care. Even the smallest compromise can lead to devastating consequences. So, what do I like most about the code of ethics? It's the fact that every BSN trained nurse knows the importance of them. We can expect the very best from one another. I'm sure you've seen how we work around here. It's like a well-tuned machine. That's because of our professional culture. As a nurse professional, I know what's expected of me. I also know how our system works and what I can expect from others. For example, when we need additional training, we get it. When we have questions, we are free to ask. The culture of nursing is one of respect and honest teamwork. BSN nurses also know the importance of staying active in organizations that promote professionalism in the field. Some are the American Nurses Association, the American Association of Colleges of Nursing, and the International Council of Nurses. There are many others, but this gives you an idea of how we stay informed. You might notice that nurses shine with their own personalities. That's one of the best things about baccalaureate-trained nursing. We learn the important aspects of nursing care, but we're also encouraged to incorporate our own philosophy into our work. My personal philosophy includes honesty and integrity, care and compassion, lifelong learning, and evidence-based practice. Well, everything looks great here, George. I'll be back to see you again soon.